Hey guys, my name is Michaela Cook. For my etiology presentation, I have chosen to do Clostridium difficile, also known as C. diff. I have chosen to do C. diff because it really fascinates me. I work in the hospital in my town as a certified nursing assistant, so I'm constantly around patients who are infected with this awful pathogen. I also chose this bacteria for my presentation to help me learn and understand more about the bacteria and how careful I have to be when dealing with patients who have this infection. On the first slide of my video, you will see a picture. That is a picture of a colonoscopy that was done, and you can actually see the Clostridium difficile inside the colon pathway. On slide 2, you will see a picture of a man who is suffering with diarrhea and abdominal pain. I think he just might have the C. diff infection. So what is Clostridium difficile, you may ask? Go to slide 3 to find out. C. diff is defined as a bacterium that causes symptoms that vary from diarrhea to a life-threatening inflammation of the colon. Many people have died from the C. diff infection. Clostridium difficile is a gram-positive, anaerobic, spore-forming, toxin-producing bacterium that is part of the normal gut flora of neonates. Clostridium difficile colitis is an infection of the colon by the C. diff bacteria. C. diff colitis is a result from the disruption of normal, healthy bacteria inside the colon. This powerful and deadly bacteria can be massively disrupted by antibiotics. C. diff can be transmitted from person to person by spores in the air. This is how C. diff is usually spread. This nasty organism can cause severe damage to the colon and in many cases can be fatal. On this slide, the picture you see to the right is a picture of what the C. diff bacteria looks like under a microscope. If you go to slide 4, you will see the relationship between the human microbiome and the C. diff infection. The human microbiome is very interesting to me. The human microbiome is defined as a large collection of microorganisms that live in and on the human body. The human microbiome helps to control digestion, and it also greatly benefits your immune system. Clostridium difficile massively disrupts the human gut. When C. diff enters the digestive tract of a person, it then rapidly grows and wreaks havoc in the gut. The image on the left shows the human microbiome as a whole. It also shows what kinds of bacteria are found in different parts of the body. This picture is very interesting to me. On the next slide, you will see the different causes of C. diff. There are many different causes of C. diff. Clostridium difficile is found throughout the environment. It is found in the soil, air, water, human and animal feces, and also in food products such as processed meats. C. diff is found pretty much everywhere and all around us. The spores from C. diff bacteria are passed in feces and spread to food surfaces and objects when people who are infected do not wash their hands thoroughly. Correct and thorough hand washing is so important for everyday life. C. diff can produce toxins that attack the lining of the intestine. This is what really destroys the healthy microbiota of the human body. People that have other infections will use antibiotics that destroy some of the normal helpful bacteria. So therefore, without enough healthy bacteria in the gut, the C. diff can rapidly grow out of control. This is when it gets very dangerous for people who are infected with the bacterium. There are many antibiotics that lead to Clostridium difficile infections. Some of these antibiotics include fluoroquinolones, cephalosporins, penicillin, clindamycin, vancomycin, and metronidazole. These antibiotics can be really harmful. On the next slide, you will see how C. diff can be transmitted. C. diff is transmitted everywhere. There is a very high risk for reoccurrence for people who have recently been in a healthcare setting, such as hospitals, nursing homes, and long-term care facilities. This is why I am very cautious and careful since I work in a hospital every week. Clostridium difficile is so very contagious. This dangerous pathogen is spread from person to person on hands, cart handles, bed rails, bedside tables, toilets, sinks, stethoscopes, thermometers, telephones, and remote controls. It can be spread everywhere. Some people are carriers but have no symptoms, yet they are still infected with the bacterium and can spread it to other people. The picture you see there on the right shows how many germs and bacteria can be spread from a simple handshake. This next slide shows all the different symptoms of C. diff. There are many symptoms of C. diff. You can have mild to moderate infection, where those symptoms include watery diarrhea 3 or more times a day for 2 or more days, and mild abdominal cramping and tenderness. Or you could have the severe infection, where the symptoms include watery diarrhea 10 to 15 times a day, abdominal cramping and pain that may be severe, rapid heart rate, fever, blood or pus in the stool, nausea, dehydration, loss of appetite, weight loss, swollen abdomen, kidney failure, increased white blood cell count, and sepsis. If you have severe symptoms of C. diff, you are very sick. The pictures on this slide show all of the different symptoms that I have just mentioned. This next slide shows the systems that are affected by the C. diff. C. diff does not affect many different body systems. The major system that is affected by C. diff is the gastrointestinal tract, also known as the gut. Other systems that are involved due to dehydration include the cardiovascular system, which causes low blood pressure and an increased heart rate, and the urinary system, which can cause renal failure. The image you see on the left shows the C. diff bacteria invading and infecting the lining of the colon. This next slide shows the different treatment options for the C. diff infection. There are a couple different treatment options for C. diff patients. Antibiotics that have possibly triggered the C. diff need to be stopped immediately. Antibiotic treatment includes metronidazole, vancomycin, and fidaxomicin. These antibiotics will help to treat the infection for patients that are hospitalized. For patients that have been hospitalized, they do have to be placed in a private room on enteric precautions. Very strict hand washing is an absolute necessity. A fecal transplant is another way of treating C. diff. A fecal transplant is used if nothing else has worked yet. A fecal transplant is the transfer of stool from a healthy donor into the gastrointestinal tract of an infected patient. This is for the purpose of treating recurring Clostridium difficile. A fecal transplant is done by a colonoscopy or through a nasogastric tube. This next slide shows a couple different pictures that talk about fecal transplants. The graph below shows and depicts how a person's age can be a major risk factor for getting the C. diff infection. The C. diff infection is found most common in patients who are 85 years or older. This picture is very cool to me. This slide shows a picture of how C. diff can really affect and disrupt the colon. It also shows how the C. diff can really kill and destroy the lining of the gut. You can see on the left of the picture the normal gut flora, and as the C. diff releases the toxins A and B, it causes the mucosal damage, and then eventually it forms the yellowish plaques throughout the colon. This concludes my video on my etiology presentation of the potential deadly Clostridium difficile bacteria. I hope anyone that watches this learns as much as I have about C. diff. Thank you.